Good morning. My name is Dorian and I'm a registered nurse. So today's lesson will be on complementary therapies and alternative medicine. After this lesson, one should be able to explain the difference between complementary and alternative medicine, also known as CAM, C-A-M. Name 3 types of medicine and treatments that are considered to be CAM, and also describe why it is important for healthcare providers to know what alternative medicine a patient is taking. After this lesson, you will be required to take a quiz, so please try to follow along. All right, so when we use the word alternative, what do we really mean? Alternative can be defined as anything that's outside the choice of normal. So for example, when someone has a toothache and they say, apply a clove or aspirin to the tooth. When someone has hiccups and they say, suck on a sugar cube or eat a spoonful of sugar. Child's injury, your child hurts themselves and they say, oh, kiss it, make it better. That's what they mean by alternative. Some of the more common ones is like you have a cold, so you take chicken soup, or you have a cough, so you need honey and lemon. This is what we mean by alternative. Some key terms that you should know when discussing CAM will be alternative medicine. This refers to a treatment option used in place of a conventional medicine that is provided in standard care. Biologically based practices are treatments such as dietary supplements, herbal remedies with ingredients that are found in nature. They can be taken as tablets, capsules, syrups, powders, teas, and oils. Complementary medicine is non-standard treatments that can be used along with standard ones. These are believed to complement or enhance the standard treatment. CAM, complementary and alternative medicine, this term is used for medical products and practices that are not part of standard care, which is also called Western medicine. A megadose. Important term. A megadose is 10 times the recommended amount for daily personal use. Probiotics. Probiotics are live microorganisms, usually bacteria, that are similar to helpful microbes normally found in the human digestive tract. A prebiotic is an ingestible food ingredient that selectively stimulates the growth and or activity of microorganisms already present in the body. Now, traditional Chinese medicine, also known as TCM, is a complete healthcare system that is thousands of years old. Is based on the belief that vital life forces move through the body. The TCM doctor's goal is to restore the internal energy balance and the external elements of earth, fire, water, and mental. CAM. Alternative medicine or complementary and alternative medicine is the term used for medical products and practices that are not part of standard care. Standard care, also known as Western medicine, is what medical doctors and health professionals such as registered nurses and physical therapists practice. Alternative medicine refers to treatment option used in place of conventional medicine that is provided in standard care. A complementary medicine refers to non-standard treatments that can be used along with standard one. In this lesson, you will learn about the differences between alternative and complementary, as well as the various types of CAM, including natural products, mind, body, and medicine, and manipulative body-based practices. We will also cover safety concerns regarding CAM use and explain how CAM differs from standard care. Many people swear by CAM treatments and medications. The claim that CAM treatments providers make about their benefits can sound promising. However, researchers do not know how safe many CAM treatments are or how they will work. Research is still underway to determine the safety and usefulness of many CAM practices. Some interfere with mainstream practices, which can be very dangerous. The boundaries between CAM and standard care are often blurred, and specific CAM practices may over time become widely accepted. We're going to focus on safety. A focus on safety, but it's natural, is what you will hear the patient say. The expression is often used to describe an alternative or complementary treatment. It may be natural, but home health aides must understand that natural does not equal safe. To keep patients safe, home health aides must know what different types of alternative medicines involve and why they will be used. As a group, discuss ways that a patient might use alternative medicine, including ways it can help or harm him or her. First, let's define the types of medicine that are considered a deviation from standard care. First, let's define the different types of medicine that are considered a deviation from standard care. Alternative medicine, the use of CAM in place of conventional medicine. Complementary medicine, the use of CAM together with conventional medicine, such as using the acupuncture in addition to usual care to help relieve pain. Most use of CAM by Americans is complementary. Integrative medicine combines treatment from conventional medicine and CAM for which there is some high-quality evidence in safety and effectiveness. It is also called integrative medicine. Examples of integrative practices include dance therapy, meditation, music therapy, prayer, relaxation, and spirituality. So on table 3.1, it just have different lists of vitamins like vitamin B1, vitamin B2, and the effects they can have on the body. You can go over table 3.1 and it'll tell you about vitamin B1, vitamin B2, B12, all the way up to B13. Those are all considered complementary therapies. As I explained earlier, a megadose is 10 times the recommended amount of a supplement for daily personal use. Some experts suggest that doses this high are no longer supplement but drugs. Megadoses are especially dangerous. A person who suddenly stops taking them will become very ill, and the body is used to having this product present in the abnormal amounts. When the substance is no longer available, the body may go to a form of withdrawal or chemical shock. Megadoses can cause inaccurate values for numerous lab tests. For example, megadoses of vitamin C can make it appear that a person is a diabetic. It can also cause elevated uric acid and cholesterol and make it appear as if there is blood in the stool. Vitamin A is necessary for good vision. However, taken in high doses, it can cause blindness and liver failure. Beta-carotene is the chemical parent of vitamin A. This is the substance that causes carrots to be orange in color. When taken in megadoses, a person can turn orange and make it appear as if he or she is jaundiced. Jaundice is always a severe condition that requires a complete medical workup. The skin color caused by carotene is harmless, but physicians may be unaware that the person is taking the supplement. Toxic effects of megadoses have been identified for the majority of vitamins. Herbs and medications, they include flowering plants, shrubs, tree, moss, seaweed, and fungus. Herbs can be especially dangerous if taken incorrectly. Many react negatively with the medical drugs. They can cause life-threatening complications when taken with heart drugs. Ginkgo biloba and St. John's wort are especially risky. Some herbs can increase potential of traditional medicine where others can decrease the potency. Herb-drug interactions can cause problems with blood clotting, liver enzymes, and abnormal electrocardiograms. All are very serious conditions. Some react negatively with anesthesia, causing side effects and interaction as well as complications during surgery. It is essential that your physicians know all drugs and supplements that you are taking. CAM natural products also include probiotics, live microorganisms that are similar to microorganisms normally found in the human digestive tract, and they may have beneficial effects. Probiotics are available in food like yogurt as a dietary supplement. They are not the same as prebiotics, which are ingestible food ingredients that selectively stimulate the growth and or activity of microorganisms already in the body. According to the National Center of Complementary and Integrative Health, the most commonly used natural product among the adults is fish oil and omega-3s. The federal government regulates dietary supplements primarily through the FDA. That said, the regulations for dietary supplements are not the same for those prescription or over-the-counter drugs. In general, regulations for dietary supplements are less strict. For example, a manufacturer does not have to prove the safety and effectiveness of a dietary supplement before it is marketed. Harmful ingredients have been found in some supplements. Most of these have been manufactured outside of the United States. Once a dietary supplement is on the market, the FDA monitors the safety and the product information. And the Federal Trade Commission monitors advertising. Manufacturers are not permitted to make claims of specific cures such as this product cures cancer or this product will help you lose pounds in 50 days. Or this product will help you lose 50 pounds in a month. So now we're going to go on down to mind and body medicine. Mind and body medicine focuses on interactions among the brain, the mind, the body, and behavior with the intent to use the mind to affect physical functioning and promote health. Many CAM practices embody the conception in different ways. Meditation techniques. This includes specific postures, focused attention, or an open attitude toward distractions. People use meditation to increase calmness and relaxation, improve psychological balance, cope with illness, or enhance overall health and well-being. Yoga. The various styles of yoga used for health purposes typically combine physical postures, breathing techniques, and meditation or relaxation. People use yoga as part of general health regimen and also for a variety of health conditions. The TCM, also known as Chinese traditional medicine, a complete health system that has been used for many and thousands of years. It has changed very little over time. TCM practitioners treat the vital life forces that flow through the body. Disease results from imbalances in the energies that make up the life force called the yin and the yang. The TCM doctor's goal is to restore the balance between the internal body organs and external elements of earth, fire, water, wood, and mental. Forms of treatment include acupuncture, burning herbal leaves on or near the body, cupping, which is the use of a warm glass jar to create suction on certain points of the body, movement, concentration exercise, massages, and herbal remedies. In acupuncture, this is the practice of inserting thin needles into the body at a specific point to improve health and well-being. It originated in China more than 2,000 years ago. American practices of acupuncture incorporate medical traditions from China, Japan, Korea, and other countries. In the United States, the best-known type involves putting hair-thin metallic needles into the skin. Acupuncture is considered to be a part of mind and body medicine, but it's also a component of energy medicine, manipulative and body-based practices, and TCM. Research has shown that acupuncture reduces nausea and vomiting after surgery and chemotherapy. It can also relieve pain. Researchers don't fully understand how acupuncture works. It might aid the activity of your body's pain-killing chemicals. It also might affect how you release chemicals that regulate blood pressure and flow. This lack of understanding is a common theme in the use of CAM. Other examples of mind and body practices include deep breathing exercises, guided imagery, hypnotherapy, progressive relaxation, and Tai Chi. Spinal manipulation. This therapy is practiced by healthcare professionals such as chiropractors, osteopathic physicians, naturopathic physicians, physical therapists, and some medical doctors. Chiropractic care. At one time, chiropractic was considered an alternative treatment. It is now recognized as mainstream. It takes a different approach from standard medicine in treating health problems. Chiropractors believe the nervous system must function properly for good health. They do not prescribe drugs. Their practice is based on the premise that nerves run through the spinal cord, so the vertebrae must be in good alignment. Chiropractic adjustments are done to relieve pressures on nerves, muscles, and joints. Some chiropractors have expanded their practice to include acupuncture, electrical stimulation, and other modalities. Most promote good nutrition, diet, and exercise to maintain good health. The basic concepts of chiropractic are: your body has a powerful self-healing ability, your body's structure, mainly the spine, and its function are related. The goal of chiropractic therapy is to normalize this relationship. Chiropractic professionals are doctors or chiropractic or DCs. They use a type of hands-on therapy called chiropractic adjustment. They use their hands to apply controlled pressure to the spine. Chiropractic care focuses mainly on the spine and involves many very fine maneuvers to prevent interruptions in nerve flow. Many people visit chiropractors for treatment of headache and back pain. Now we're going to talk about osteopathic medicine. Many people think that osteopathic medicine is an alternative practice, but is fully accepted as a form of mainstream medicine. A doctor of osteopathy, a DO, receives a complete medical education similar to that of a medical doctor. The DO can perform surgery, deliver babies, and specialize in any area of medical practice. In addition, he or she learns how to provide osteopathic manipulative treatment, a treatment that involves a passive thrusting motion to manipulate the spine and restore normal movement flow or oxygen and removal of waste. OMT is used in combination with regular medical treatment and is considered a routine part of osteopathic care. Now, let's discuss osteopathic medicine versus chiropractic medicine. Chiropractic and osteopathic treatments are not the same. Chiropractic care involves many very fine maneuvers of the spine to ensure that nerve flow is not interrupted. The osteopathic physician focuses on the movement of air or oxygen and fluid within the body by relieving pressure on the muscle and joints and ensure tissues are nourished with oxygen and waste are removed from the body fluids. The osteopathic physician uses OMT as part of regular medical care. The chiropractor uses spinal adjustments. Because of this, the DO has a wider scope of practice. Now, massage therapy. This therapy encompasses many different techniques. In general, therapists press, rub, and otherwise manipulate the muscles and other soft tissues of the body. People use massage for a variety of health-related purposes, including to relieve pain, rehabilitate sport injuries, reduce stress, increase relaxation, and address anxiety and depression, and aid general well-being. Okay, now let's discuss the home health aide's role. Although many people use different types of cams for their health, it is important to understand whether it's right for your patient. Often it is, but sometimes patients will be given something that could interfere with their treatment plan or other medications they are taking. Natural products present the biggest problem as they can be purchased over the counter. The home health aide's role may include: be very aware. Some dietary supplements may interact with medications or other supplements, may have side effects of their own, or may contain potentially harmful ingredients not listed on the label. Make sure you are alert and pay attention to any medication type product that the patients are taking. Make sure that the nurse is aware. Observe and report. As a home health aide, it is your job to observe and report on the patients. Do you notice medication type products in the home? Is the patient taking them? Did the family bring the patient something that looks like medication? If you question the patient, he or she may simply say, "Don't worry, it's natural." But it's still very important to report anything out of the ordinary to your supervisor. Have an open mind. Not everyone thinks alternative medicine is feasible substitute for standard care, but many people do. If your patient is taking alternative medicine that is approved by his or her primary care physician, then it may be safe and an effective way of getting the care the patient needs. Make sure you help them with their alternative medication the same way you would if it was a more standard type of medication. Now we're at our case study. Today we have a family member from China. Let's go. A family member tells you she is going to order $100 worth of herbal supplements through a website that she found. She explains that the cost of the supplement is less because they are manufactured in China rather than in the United States. The website advertises you can lose up to 50 pounds in 90 days. Information on the website suggests that no lifestyle changes are necessary and you do not have to change your diet or exercise program as long as you take the supplements. She said the supplement will cost $300 if she bought them in the local health store. She says if it is natural, it is safe. She takes the medication every day to control diabetes, high blood pressure, and elevated blood cholesterol. She does not plan to consult her physician because she will be using natural, non-medical products. How would you respond to your family member's plan to lose 50 pounds in 90 days? First off, that is not safe. If you lose 50 pounds in 90 days, the standard rate should be about 1 pound a week. So anytime, if it sounds too good to be true, it probably is. Always, always, always ask a physician before buying or taking any supplements. How do you feel about her choice of a vendor and any advice? So she wants to buy the pills from China because they're $200 cheaper. However, things made in China are different from things made in the United States. At this point, you should educate the patient and the family about the risks that can come along with buying medication off the internet alone and coming from China where you don't know exactly what's in the bottle. So always, again, discuss with a physician before making this type of decision. Number 3, how would you respond to the comment, it's natural, it is safe? By simply re-educating the patient that natural does not equal safe, though there are two different things. And again, discuss with the physician. Would you suggest she consult her physician? If yes, how would you explain why this is necessary? Okay. Would you suggest she consult her physician? Yes. How would you explain why this is necessary? And if not, why not? And explain your answers. So we've already discussed that the doctor should know about any medications being taken, and also there's no reason not to tell the doctor because the doctor should be involved with any medication. How would you respond to the claims that no lifestyle changes are necessary? I would just simply say that no healthy weight loss come without change, and that just doesn't sound realistic. However, again, you would just let the doctor know and also educate her to let the doctor know that that's what the pills are saying. And lastly, what advice would you give this family member? The advice you would give her is to let the doctor know, educate her on the risk of taking supplements and the mix that they can have and the effect that they can have with the standard medication. All right. And lastly, you are considering buying some vitamins because you are always on the go and you do not eat right. You often stop and pick up food or candy and soda and eat while you're driving in the car. Before beginning the regimen of vitamins, what do you need to know? Should you do anything else? You look at several different bottles in the health and food store and read the labels. The information is different on each. What information would be helpful to you? Again, each person is different. Always consult with the doctor before starting a vitamin or any medication, just for safety reasons. That's it.